This is a wrap-up video on acute respiratory distress syndrome, otherwise known as ARDS. It actually used to be called adult respiratory distress syndrome until we realized that children can have it also. All right, so exactly what is ARDS? If you look at this picture down here, you can see that this side is the injured alveoli. So I always say the lungs are like an upside-down tree. You've got your bronchial up at the top, and then you've got your tree at the end with the little berries, which are the alveoli. And in a normal alveoli, you can see there's some good gas exchange going back and forth. But here, obviously, there's a lot of neutrophils and interleukins, immune complexes going on, and this lining is damaged. So basically you cannot get any oxygen or carbon dioxide exchange. Does not work. If you look at a chest x-ray of an ARDS patient, you don't have to know how to read chest x-rays, but you can just look at the difference between a normal and an ARDS patient. You see how cloudy it is. Well, that's full of infiltrate, another word's called opacities, fluid, and that's one of the criteria to have bilateral pneumonia. Patients at risk for this are patients with sepsis, pancreatitis, blood transfusions. It's not always easy to diagnose with ARDS. Sometimes you just have to assume until proven otherwise. But there are certain criteria that do end up excluding other things from ARDS, such as usually ARDS don't have any cardiac complications or cardiac issues when this acute respiratory distress syndrome is going on. Nothing's working, the patient's on the vent and it's still not working. So all in all, nursing care priorities are obviously airway breathing, but it's really a lot about supportive care, and supportive care for not only the patient but the family. I will not go into ventilator talk. You will be doing that in a simulation, but that's basically what it is. It's ventilator care, as well as sometimes they're put on an ECMO machine, which I always say it's like dialysis, but it's for the lungs. So it's basically artificial lung, doing the carbon dioxide oxygen exchange. And also when it gets to be more severe, which is the proliferative or fibrotic stage, these patients are put in a prone position. And we've seen this a lot more in COVID patients where it is gravity. So laying on your stomach is what's been recommended for patients with respiratory issues with COVID. So in a nutshell, with clinical findings, this patient's going to have worsening tachypnea, dyspnea, hypoxemia, tachycardia, bilateral infiltrates. They may initially be in respiratory alkalosis as their tachypnea decreases their carbon dioxide. However, as it progresses and gas exchange worsens, the arterial blood gases shift into respiratory acidosis, followed by metabolic acidosis because the tissues become hypoxic and hence anaerobic metabolism. So there's a ventilation perfusion mismatch, and this leads to severe hypoxia. And one more hallmark sign of ARDS is profound hypoxemia despite increasing oxygen delivery. This is also known as refractory hypoxemia. So as you can see, that gas exchange and oxygenation are very important, and that's basically how we're treating the patient with the PEEP, the positive end expiratory pressure. That is the mainstay of therapy for patients that are mechanically ventilated to help with the gas exchange. As far as other type of care, fluid management can be very tricky because remember, this patient usually does not have any cardiogenic pulmonary edema. So it's definitely a fluid volume balancing act with this patient. As far as nutritional support, that's obviously very important. We need to have protein, carbs, fat intake. So you don't need to know that, but just know it anyway. I mean, you should know that we need nutrition to help improve oxygenation. It does help decrease mortality rates. It has been shown to do that. As far as complications, as we know that it can go into MODS, multiple organ failure. And once they get to the proliferative fibrotic stage, it's really talking to the family about end-of-life care and what the choices are that are going to be made for end-of-life care. So in summary, there's not any specific treatment that cures ARDS. It's more supportive care. There are a lot of treatments now in research trials, which I won't go into. Just to name a few, though: prostaglandins, statins, albuterol. There's other things, but anyways, think supportive care. Mortality rate is high. We do the best we can. Support the family. Support the patient, and airway and breathing.